Hello, this is Chip Caldwell with Caldwell Butler and Associates to explain our path to sustainability practices of top lean organizations. Based upon the only program that the American College of Healthcare Executives offers in lean for senior executives, and upon our over 20 years of American College sponsored research of how top performers adapt lean to their various organizational needs, cultures, and uniquenesses. First, our research suggests that training alone has proven to be a decided failure factor in organizations who wish to embark upon lean as an organization wide change model. In our work, we have established an 8-step process that encompasses utilization of the 100-day lean workout process and its structure. And this 8-step method has shown to be a high predictor of success. I'll explain each of those in some detail, but your document explains in a lot of detail each of these steps. First, top performing organizations establish leadership and support roles that I'll explain in a moment. Secondly, organizations select high impact core process focus areas like the emergency department, surgical services, outpatient services, inpatient services, etc. You can select up to 8 core processes in any given 100-day lean workout time period. Thirdly, they establish strategies to develop appropriate challenges and meeting stretch goals for everyone within the organization. Fourth, they have a consistent pattern for key dates versus trying to get on anyone or everyone's calendar at different times. For example, the third Wednesday of every month, each team comes together to showcase their results. Third, they have results tracking, and I'll show some screen captures of our GPS online tracking app here in a few minutes. Next, they at times will offer appropriate education and practicum experience during the monthly check-in for directors. Next, they have strong communication plans so that everyone in the organization hears the same message at the same time, and they repeat this process every 100 days, hence the reason we call it the 100-day lean workout. However, it's important to note that you may choose to name it anything other than the 100-day lean workout, as King Faisal Hospital Research Center named theirs the rapid improvement process. That we can discuss that with you at the appropriate time. First, let me explain the two constructs in the change model we call the 100-day lean workout, which is led by senior leaders. And then I'll explain rapid cycle testing, a tool for directors to ease their anxiety regarding the change process and to prove effectiveness. The lean workout structure is a structure that leaders need structure, and that organizations that embark upon a training-only approach often fail to achieve the optimization of lean because they don't provide a senior leader driven and led and organized structure in which everyone participates. It's not a project. The 100-day lean workout is rather a multi-year change model in which all of the key staff participate all at the same time, as opposed to the ineffective approach many training organizations try to apply, where you pick just one area to work like ED or laboratory or one organization at a time. That has proven not to be successful. It is more important that we have all key staff participating from the very beginning. Thirdly, the 100-day workout process is a 4-month process in which directors, lean black belts, and other key stakeholders test and validate their changes using a construct we call rapid cycle testing. And then finally, the 100-day lean workout facilitates organization-wide learning and application. Everyone learns together instead of just one pocket like emergency department or one pocket like pathology or laboratory. Everyone learns together. So as a multi-year construct, how does the 100-day lean workout look? Well, as you can see from the graphic in front of you and also in the document, is that the goals are set in 100-day increments so that 3 times during the 12-month period, senior leaders articulate at this time it is important for us to improve, let's say, patient experience or patient satisfaction. Or in this 100-day period of time, it is important for all of the departments to improve their clinical outcomes. The organization 100-day lean workout looks like this. There is a kickoff day, which, as your document will explain, is a 3/4 day event in which all of the directors and their key constituents come together to review goals and targets, training and new tools if those are appropriate, to develop their 100-day action plans. These are the plans and the changes that we will make over the next 100 days to improve our throughput. And then following the kickoff day, in 30-day increments, we have check-ins that last only a couple of hours in which directors of the participating departments articulate the changes that they've made to achieve the goal of the particular department. There are also some key roles, and this is explained in detail in your document on pages 3 and 4. First, the CEO or the senior team selects a Chief Implementation Officer. This is the individual on the senior team whose role is to, in collaboration with the senior team, the lean black belts, and the department directors, to assure that the 100-day lean workout structure is operating effectively and to recommend tweaks to that process as you move forward 100 days by 100 days by 100 days. Secondly, there are green belts who will ultimately become black belts. In most organizations, that would be up to 20 people who are certified as black belts. Many training organizations recommend that everybody in the organization be trained as green belts. And while that might certainly be appropriate, the key drivers, the key effectiveness of the organization's lean program will in fact rest in the hands of a select few, not the useful many. Third, there is need for a finance liaison. Lean is a program whose purpose is to improve throughput, to improve patient experience, and to improve clinical outcomes. However, the reduction of wasted time in processes like nebulizer treatment time in the critical care unit do in fact have a financial gain in which the organization can redeploy its resources to more strategic needs other than waste. And it is the role of the financial liaison to help the department directors and the lean black belts to really nail down exactly how much savings has occurred. And then the fourth role is that of the communication coordinator. All of these roles are explained in great detail on pages 3 and 4 in your document. Let's talk about rapid cycle testing for a moment. One of the uniquenesses of the Caldwell-Butler approach that you won't find in others is training directors, or the black belts training directors, how to test their own ideas. Rapid cycle testing builds credibility and belief in the changes. Often lean fails, not because the analytics aren't well done, but rather because of the natural organizational fear and resistance that occurs when the whole idea of changing anything comes to be discussed. And so what are the possibilities within a rapid cycle test, which by its name, by the way, occurs with just 30 data points, one shift, one day, never longer than 3 days, with the idea to first, was this change unsuccessful? If it was, let's reject it early and not waste more time on it. Most changes we find, or directors will find, need a little refinement. The idea is a good one, but it's not yet ready for prime time. It's not yet ready to make the policy or the practice in the department. And then finally, some changes are successful. If so, let's hardwire it and quickly move on to the next change. So the rapid cycle testing process begins with 30 data points, no more than 30 data points needed in the pre-test baseline setting, as you can see in circle number 1 on the example rapid cycle test. Then let's make the change. That change will occur over a shift, over a day, never more than 3 days. And then finally, let's run a 30 data point post test of the data. Some examples. From when the physician writes the discharge order until the bed is ready for the next patient, this rapid cycle test asks the question, during patient throughput improvement, clean times were improved by housekeeping or environmental services. Did that clean time improve the overall discharge throughput or not? That's a rapid cycle test worthy of validating the effectiveness of that change, of the housekeeping's change. Or in the emergency department, triage improved their process, resulting in quicker time to the physician from triage. In this case, 88% of the patients in our test, or our rapid cycle test, seen within 30 minutes. So the question in the rapid cycle test, over those 3 days of the test, January 17, January 18, January 19, as you can see in the slices shown in the blue dashes on the chart or on the rapid cycle test, answering the question, when we improved time to ED bed, were we able to improve patient treatment time overall? And then finally, showcasing interdepartment collaboration. So in respiratory therapy, as they collaborated with the intensive care unit, as nebulizer treatment time is decreased in ICU, did we in respiratory therapy in fact contribute to the overall collaborative team effort to improve ICU quality? And then the final explanation, this is found later in the document, pages 6, 7, 8, and 9, I think. Top performers track their process. And we at Caldwell Butler have an online results tracking application we call GPS at caldwelltools.com. And you can see the screen capture here in which our tools are showcased. You can see GPS there in the middle, in the top middle, and just below it, the rapid cycle testing module that directors use to test their changes. And so the sign-on is quite easy. Each director, lean black belt, senior leader, anyone in the organization who the CEO and the senior team feel should have access to the online tracking system GPS, simply enter their email as the username and then design their login, and they are inside the system, which shows and showcases the results of the overall progress in a real-time way. Again, refer to your document for more screen captures on Accelerator. And then finally, let's talk about Caldwell Butler's path to sustainability. We work with you hand in hand over a period of several months through 2 100-day workout periods. And as you can see, there are 2 tracks of mentoring and coaching and training. First, the executive team itself, one of our staff folks, will be on site the first month for 2 days, followed by several months of 1 day of on site to work with the executive team and individual executives, asking the question, is the 100-day lean workout process in particular, and is the lean deployment working as you had anticipated? And if not, let's make some tweaks. And the directors receive the same level of coaching by our senior coach over a period of that same period of time. We begin our process with the pre-planning workshop. It is when we are on site for 4 days and assuring that we understand the objectives for the program, the lean process, and create the detailed logistics for rolling the first 2 100-day lean workouts. And so you can see in yellow the training, and in green the application of that training in 100-day increments that we call the 100-day lean workout. So green belt training, of course, starts. So in the first month, the up to 20 green belt candidates are trained in 4 days, a 4-day period in that month of didactic training, followed by the next month 4 more days, a lot of homework in between, and then finally 2 days for the examination and for each green belt to achieve certification by showcasing and sharing the project in which they use the green belt tools. That same month is the launch of the first 100-day lean workout as a practicum, in which 8 department directors, or up to 8, it could be a couple, but up to 8 department directors, along with their key stakeholders, come together for a period of 4 months or 100 days. And in that period of time, the newly minted green belt, lean green belt staff work with the department directors and their key constituents. And that our individual coach is on site 8 days for the first month, 8 days for the second month, and then as the changes that the green belts are stimulating with the department directors, that winds down to 4 days per month in the final 2 months. Then our certifier offers for green belt certification much more intense. In fact, at the conclusion of the black belt certification process, these candidates will have achieved the equivalent of a baccalaureate degree in both industrial engineering and applied statistics. That period of time is also paralleled with a 100-day workout in which the black belts are applying their skills with the department directors as their collaborators over a period of 3 months of training, followed by a month of certification, at which point the organization, with the combination of the senior team coaching and the department director and black belt coaching, is ready for sustainability. And over the period of the next 3 years, you have access to the online tracking system we call GPS to keep track of your results and make tweaks when necessary. That, in a nutshell, is a quick overview of the Caldwell Butler path to sustainability. Refer to your document for much greater detail than I've been able to provide in this brief overview. Thank you for your time, and we look forward to working with you.